When most people think of addiction, they often imagine substance abuse involving drugs or alcohol. But addiction takes many forms, and not all of them involve chemicals. There are two primary types of addiction: substance-based addictions and behavioral addictions. Both types can have equally profound effects on a person's brain and life, and understanding the difference is important for recognizing and treating addiction. Let's talk first about substance-based addictions. These are the more commonly recognized forms of addiction involving alcohol, prescription drugs, or illegal drugs such as opioids, cocaine, and methamphetamines. In substance-based addictions, the repeated use of these substances changes the brain's chemistry, making it more difficult for a person to feel pleasure without them. The cravings and physical dependence that develop can lead to a cycle of continued use, despite knowing the harmful consequences. Different substances impact the body and brain in unique ways, but they all share one thing in common: they manipulate the brain's reward system. Over time, the person's body may develop a tolerance, meaning they need more of the substance to achieve the same effect, leading to further dependence. Behavioral addiction doesn't only arise from substances. Certain behaviors can be just as addictive. Behavioral addictions involve compulsive engagement in activities that trigger the brain's reward system in similar ways to drugs. Examples of behavioral addictions include gambling, gaming, shopping, and even excessive internet use or social media. Just like with substance addictions, people with behavioral addictions continue to engage in the activity despite negative consequences, whether it's financial ruin, damaged relationships, or emotional distress. These behaviors may initially provide a sense of relief or pleasure, but over time, they become harder to control and can dominate a person's life. Understanding that addiction isn't limited to substances helps expand our view of what can lead to dependence. Whether it's a drug or a behavior, addiction disrupts the brain's natural balance and requires appropriate treatment and support. In the next section, we'll look at the risk factors that can make some individuals more susceptible to developing addiction and why it can happen to anyone, regardless of background or circumstances.